You're watching NorthState Health, the North State's first local health program.
Tell us a little bit about how the treatments have changed over time. Luckily, I mean, obviously as medicine gets a lot better, I mean, the treatments are a lot better. So tell us how things have changed recently.
Good. So one of the big changes that's happened in ankle replacement surgery is that we finally figured out how to do it. Back in the 70s, we started doing ankle replacements, and they had really pretty uniformly bad results. And so when I did my orthopedic training, we were taught basically never do an ankle replacement, just always do a fusion. And in the last 5 or 10 years, quality ankle replacements that give good long-term results have come out. And we're very excited about that because a fusion takes all the motion in the ankle joint away, and an ankle replacement retains usually about half the motion, not all the motion. But what that does is it protects the other joints in the foot. The adjacent joints don't have to do extra work because of the fusion of the ankle. And so the rest of the person's foot winds up doing better with the ankle replacement.
Okay. We want to talk about some success stories a little bit. I mean, you've seen the ankle replacement and this and that, but obviously, I mean, people can have these treatments, and you said you have seen some people in some pretty short order be able to get back to some pretty regular life activities that they want to do.
That's correct. The ankle fractures, we routinely treat routine ankle fractures, the most common ones, with surgery to put the bones back in place, and those typically heal within about 6 weeks. And we have patients weight bearing within about 4 weeks, and at about 3 to 6 months, they're back to their previous activity 90% of the time. It's not a 100% guarantee, but most of the time they do very well. Yeah,
so definitely there is a chance to go ahead and heal very quickly. So it's like, it's not something that's a lot of time. I mean, I think that's just amazing.
Correct. We've also seen some improvements in fracture treatment in patients that are older. And we're very excited about that because as the population is aging and staying healthy and active longer, we're seeing athletic activities in older patients and athletic injuries in older patients. And so we've developed in the last 10 years a technology called locking plate technology. And those locking plates allow us to take bone that's perhaps osteoporotic, that's a little bit softer than it was because the patient's older, and use the locking plate technology to get the good results in older patients that we have been getting in younger patients for a long time.
Okay. At what point should people come in and get evaluated at least? I mean, are there some symptoms that people can look at? Obviously pain, but I mean, what is normal and what isn't normal? When should they come and see you?
Correct. Typically pain that exists for more than just a few days. Anybody can wake up with a sore ankle and 2 days later it's okay. And that probably doesn't need to be treated by a doctor. The ongoing problems, especially functional problems, the limitation, how far you can walk, how long you can stand, that type of thing, really ought to be evaluated. Some kind of subtle problems can turn out to be very serious if they're not treated, especially long term.
All right, thank you very much, Dr. Lange.
You're watching NorthState Health, the North State's first local health program.